So Doc, we are starting.
Okay.
Hello, good afternoon, everyone joining us today. Today we have the team from M.P. Shah who are going to be taking us through this week's webinar. We've decided that we all know what is happening with the third wave. I think there's been many more infections happening on a daily basis. There are discussions around the new variants. There's also discussions around the vaccines that have just been rolled out recently in Kenya, and we said that this will be a good chance for us to just revisit the discussion around COVID-19. What has changed? What do we need to do to continue protecting ourselves and our families? So we have Dr. Vishal Patel, who is the medical director at the M.P. Shah Hospital, who's going to be taking us through the presentation today. After the presentation, we'll have a Q&A session, which we'll have Daktari answering all the questions we have. So feel free to start typing your questions in the Q&A panel. So karibu sana, Dr. Vishal, you can begin. You can unmute.
Are you getting my audio feed?
Yes.
Dr. Matola, are you getting my audio feed?
Yes.
Okay. Apologies about that. And thank you so much for inviting me for this session today, Dr. Matola and your entire team. And I'm glad that the stakeholders involved in provision of healthcare are doing this for our clients, our patients out there, so that we can, of course, look at how we are keeping everyone safe, how we are helping each other get through this very, very difficult period since the pandemic started. So just talking about COVID-19 and the title why I put it as the new normal is because we are looking at a majority of the times what we are seeing is that people tend to forget we're still in the middle of the pandemic. Most of the people have now assumed that the pandemic, most of it, the worst is behind us, and now the vaccine has come in. We're getting back to normal life. But what we need to get used to is how to live a new normal. And I'll be explaining all that as I go along. As I start off, just to give everyone, I'm sure this information is already with most of you, but just to give everyone a snapshot of what is the current status as at yesterday, globally with the pandemic. Almost 123 million cases, almost 124 million cases confirmed, 2.7 million deaths, 460,000 cases in one particular day yesterday. As you can see, it is still propagating all around the world. It is still going up.
Sorry, Dr. Vishal, if you could share your presentation. I think it has stopped sharing.
It has stopped sharing. 1 minute. How about now? One minute, let me try again. How about now? Dr. Motolo, you can see the presentation?
It's now okay.
Okay, thank you. Apologies about that. So as I was saying, this is a global map showing, as we all know, that we still have a very huge pockets in the US, South America, especially Brazil, South Africa, in Africa having many cases, and of course we all know the situation in Europe and the Indian subcontinent side as well. In Kenya, sorry, not this. In Kenya, are we still questioning if there is a third wave. I get this question a lot, that every time we talk about a wave, we see a lot of panicking. We see many people saying many things, yet some people are not feeling a difference in terms of in terms of whether there is an upsurge in cases or not. There are lots of theories out there that the upsurge in cases has been manufactured, has been brought out by people to make sure that funding is allocated towards it, and among many other things. But the numbers is what we rely on, and they don't lie. So when we started the pandemic in Kenya in March, it was basically testing of people who are going into quarantine when they come into the country after having traveled. And those people who are coming positive in the quarantine centers are the ones which were accounting for most of the infections. As we progressed along, we saw the first wave coming around June and July. And that was the time where the system was truly tested. After that, we did settle for a bit, and around October, November, we had another spike and a wave as well. Now, in all the healthcare experts in the industry and everywhere felt that there would be one more wave. They did predict another wave. The reason being, we did lax a bit in terms of our protocols and everything as a whole nation. People were enjoying festivities, Christmas breaks, traveling. So, and we were seeing reports of lapses in making sure there is social distancing and correct usage of masks, hand hygiene, among other things. So hence, the third wave was anticipated, and it is now here. As you can see, the data clearly shows the upsurge is quite steep this time. The one other thing that we want to share, I want you to appreciate in this is, if you can see the first wave, is the same as other countries, what other places are seeing. Majority of the cases will be asymptomatic. But then if you go to the second wave, the ratio of the symptomatic patient, the ratio may not have changed a lot, but the numbers significantly were higher. And that puts a lot of strain on our healthcare systems. And then now if you come to this third wave, as you can see, yes, the number of asymptomatic cases are also high, but at the same time, the number of symptomatic cases are quite enormous. So this is what is currently putting a strain on our system. When we talk about these waves, what else do we talk about? You will realize that the mortalities coincide with these waves of new infections. So the number of deaths so far in Kenya, as you can see, they are coinciding. Whenever a new wave comes, unfortunately, the number of deaths also go up. And if we look at the statistics from the ministry, in terms of what sort of symptomatology have our patients in Kenya been coming with, as you can see, 92% majority are still asymptomatic. A small proportion of symptomatic, if you look at it and say it's just 8% who are symptomatic. But these 8% are representing 1,000 people. And that means you need to have beds, staffing, medication, so many other resources available for those 1,000 people. Even if you are stretching it over the 1 year that the pandemic has been here, it's still a tall order on a system which is not used to catering for such enormous acutely ill patients. And if you can see, majority are having the usual respiratory tract infection symptoms, cough, fever, and difficulty in breathing. Then some have the other constitutional symptoms like headache, sore throats, chills, running nose, general weakness or fatigue. We are seeing in ours, fatigue is not as much as what other places may be reporting. But the other thing is, I think also people tend to take this issue of fatigue as just being part of the illness or just being tired because you are sick, and it's not being brought out as well. And if we look at the age distribution, before that, the gender distribution, 60%, 62% of the Kenyan population affected has been males, 38% females. And if you look at the age distribution, Our main concern, of course, is from this group onwards, from the 50-year age group onwards. The reason being is that while they may not form such a huge proportion, this is the population that tend to have other illnesses. This is the population that tend to complicate a bit more than other age groups. So we need to definitely bring this down. The 30 to 39 group, you'll see a lot even in the 20 to 29, but majority again will remain asymptomatic or not get severe disease in this age group unless they have other underlying conditions. So this would be again the same as seen in other places. And the next graph here explains what I've been saying, that from this category onwards, especially from the age group of 50 onwards, you will see a lot of a steep rise in this proportion contributing to the mortalities. As you can see, already 50% of the males are 50 years and onwards. This is just COVID-19 cases reported by counties, and it is as expected. All the areas which are near urban centers will have much higher rates due to population densities, due to testing being more easily available, and the more remote areas you'll see having less and less. So for example, a county, if you look at it by size, a place as big as Marsabit will have only 153 because it's sparsely populated. There are not as many cases. So this is as at 23rd of March in Kenya. As you can see, 2,050 deaths. So I know this concept has been spoken about a lot. Many of you must have heard it, flattening the curve. What do we mean by flattening the curve? And the reason we will find most people keep talking about this and keep stressing about it is because the pandemic hasn't left us. The way we were able to scale up resources as a country, I think we still did well, but we are again not in a capacity to scale up to say, okay, you know what, we'll ensure that everyone who falls sick will get to we'll get the necessary interventions they need. Every ICU patient will have a bed. Unfortunately, scaling up in such a short time is not possible for a system as a whole. And when we talk about flattening the curve, what happens is during these outbreaks of contagious diseases, you find that all of a sudden you get this sharp incline, sharp rise in the cases. And when you get this sharp rise, I'm hoping you can see my cursor. When you get this sharp rise, I'll just try to select. When you see this sharp rise, it's because of how contagious the disease, how easy it is to be passed on from one person to another. Now, the capacity of any healthcare system does not change very dramatically. It can change as development goes on, as more and more hospitals are opened, more and more private-public partnerships take place to provide this capacity, but it cannot be increased at the same rate at which the infections are increasing. So what helps? Measures taken to slow the rate of infection. What everyone keeps dreading, lockdowns, masks, social distancing, so many of those things is what helps flatten this curve so that the number of cases that we see coming out are well below the capacity of the healthcare system, and we can actually deal with them in good time and able to at least make sure it doesn't go out of control. So when the pandemic came and we needed to make sure that we are organized as a country, as healthcare systems, as support systems. So what needed to be done? Number one was continuity of essential services. So essential services, acute and emergency care, making sure the chronic patients that we have keep getting their care and medications, making sure that we are security and everything else, essential goods, foods, items, and all is taken care of. Hence, you'll see any lockdown imposed, whether it's at a local level from your office, any restriction imposed, whether it's from your office, whether it's in your estate, whether it's as a county, whether it's as a national government or a country, you'll find that majority of it tends to target to make sure that there is some continuity of essential services. We need well-coordinated implementation of priority action. So basically, every facility which is looking at how they can do their part in making sure that we are taking care of controlling the pandemic, all the priorities need to be well coordinated and implemented. Identify what is priority, what is not. Clear and accurate internal and external communication so that everyone is well aware any of the changes that we bring about, any of the changes in policy, any of the changes in the disease patterns, any of the changes in putting in new precautions needs to be very clear and accurate. And then swift adaptation to the increased demands. We have been trying as much as possible as healthcare systems to do this. As you may have seen, some hospitals may have dedicated entire buildings to isolation units. Some may have even put up, for example, field hospitals to try and make sure that they are able to expand and contract the capacity they have for these isolation cases and beds. Effective use of the scarce resources. If you remember when the pandemic started, there was a huge deficiency in the market on PPEs and the rest. Importation was not as much. Local production was just trying to be scaled up at that point. So this is when you have to make sure that all the resources that are required, that are scarce, they have to be effectively used. For example, case in point right now, the vaccine. Ideal scenario is we vaccinate all our population of almost 50 million together. But right now, we are not able to do that. We don't have all that available. So whatever vaccine allocations are being gotten, that's why it has been split up into targeting different cadres and categories first. And then, of course, making sure we have a safe and conducive environment for frontline workers. This is so that we make sure that when we need to be taken care of, when we need security, when we need healthcare, when we need food security, for example, we make sure when we need food, even let's say from just to go something as simple as buying food, we need to make sure that these frontline workers are safe and they have, so that they can continue doing their work and assisting us. So what has changed if we look at the pandemic itself and COVID-19? Transmission, it hasn't changed. It is still aerosol transmission. It is still transmitted through droplets of people who are who have the infection, through droplets when they sneeze or cough, and it is still transmitted through contact surfaces. So when people sometimes say that, oh, COVID is airborne. Now, what they mean, some people use airborne very loosely. What airborne means is that sometimes these droplet particles, the particles which contain the virus, are very, very tiny. And if it is in an area which is not well ventilated, those can still be inhaled by someone, and that's how the infection gets transmitted. But that has been seen, the particles have not been seen to be hanging around in the air for very long, especially if there is adequate ventilation, especially if people are wearing masks, especially if there is social distancing. Particles don't seem to remain suspended in the air for that long. The particles don't seem to sort of, if I can say in layman's, travel that far. That's why social distancing guidelines advocate for the mandatory distance that is safe enough between you and someone else. So transmission hasn't changed the pattern. There is nothing new. People have come with many theories of it being transmitted through blood, it being transmitted through house flies and many other things, but transmission patterns have not changed. The incubation period still also there isn't enough data to suggest that it has changed. It is still up to 14 days after someone may have been exposed to the virus. Majority of the patients, if they do become symptomatic, they do become symptomatic before the 14 days, but some can become symptomatic after the 14 days. So that hasn't changed. But a few other things that may have changed, I'll talk about a bit later when I'm talking about the variant. So when we talk about the symptoms, again, a lot hasn't changed in terms of what sort of symptoms you can get. But what we are seeing different now is that you may develop with this new wave and with also circulating different strains that have been identified in, let's say, South Africa and the United Kingdom. We also have some of those strains circulating in our own population. And what we've seen with some of these strains is that the transmission of infection from one person to another has become faster with some of these strains. So it's much more easily transmittable, and it has to do with the changes that the virus has had in terms of it mutating and being able to enter a host cell much easier than before. What the other thing that we have noticed in the symptoms is that some of the individuals are now having the infection for some time and getting into complicated or severe disease after the acute state sometimes has settled. So what I mean by that is sometimes you may have just a bit of fever for 2 days. You test yourself, you're positive, you're taking care of yourself, you're not bad enough to be hospitalized, maybe you're self-isolating at home. And then what we are noticing in some patient populations, especially the ones with comorbidities, is that they then tend to now get the respiratory problems and problems breathing a bit later into the phase of the infection. As I was explaining, the variants have been seen definitely to be much more easily transmittable. Both the South Africa and UK one, there is now a new variant that has been found, Brazil and Japan as well. So these variants, as I said, there is not a lot of data that they may be more deadly, they may be more severe and more fatal, but we definitely know they are much more easily transmittable. Has anything changed in testing? There has been a lot of development in testing, definitely, but what has not changed is what is the most accurate and gold standard method of testing. Many of the people may have heard the term PCR, and that's the test which is what it normally does is it tries to extract genetic material from the specimen that we give and checks whether there is genetic material from the virus in that specimen, and that is still the gold standard. There have been some other tests that have come out. We call them, many of you must have heard of antigen tests. Antigen tests also are, the one advantage they have is they are much quicker, but the main issue is they are not as accurate. They may have more false negative tests. So they may give people a false sense of hope that they are negative, they can continue with their routine, and yet you could be positive. The other test is tests that are available. We call them serological tests or antibody tests. Again, these are important in trying to see if someone may have had the infection, and is this, if they are getting any symptoms or complications, are they part of still acute infection, or is it part of now the chronic phase of or the continued phase of the infection? So again, the utility in saying someone is positive or negative is not a lot with those antibody tests. The most important thing that has changed is us as Kenyans, us as human beings. Yes, in the beginning when everything came, lockdowns came, people were trying as much as possible to do their best, but definitely we've let our guard down. Definitely many people are getting a lot of issues with the current with the current lockdowns and isolations and the rest. And if we don't follow that, that's what's propagating this infection. What I want to stress at this point is it's just the basics we need to do well. The transmission is, as we can see on this presentation, so masks, making sure that we are social distancing, making sure that we are doing hand hygiene, making sure we have coughing etiquette, and seeking medical assistance in time. I know we are a bit short on time, so what I'll do is I'd like to stop there. I will I may present one or two other slides if I have to use them to explain something graphically to our audience. Over to you, Dr. Matolo. There are a few other things that I wanted to discuss, but I know we are running short on time. As we do the question answer session, I'm sure those points will come up.
Yeah, so thanks a lot, Dr. Vishal. I think we'll go straight into the Q&A session. I can see quite a number of questions here. So just to begin, currently there are many cases of people with flu, a really bad flu. And at what point do we draw the line that this is not normal flu or it could be COVID?
Okay, unfortunately, there is no current method of just knowing from symptoms alone that someone may have respiratory infection like flu or influenza versus COVID. Unfortunately, from the symptoms alone, we won't be able to say that. So what we are doing, or what we need to do, is anyone at this point with the amount of community-based transmission going on, anyone at this point with any flu-like symptoms or any symptoms that are pointing towards COVID, you have fever, fatigue, you may have loss of taste, loss of smell, any other upper respiratory tract symptoms, we need to get tested. We need to make sure that it's not COVID.
Thank you. And what foods can one consume to build maximum immunity against COVID?
So again, immune boosters, foods which are rich in helping us build our immunity, like trace elements like zinc, multivitamins, among others, they are good, yes, to generally make sure our immune system is strong, but nothing is really a treatment towards COVID or 100% effective from us not getting COVID. What I would advise everyone is that eating a balanced diet. Eating a well-balanced diet will make sure that we are keeping immunologically fit. We are making sure we are not getting into other lifestyle diseases like hypertension, diabetes, and the rest, which can increase our severity of COVID in case we catch the infection. So a good, well-balanced diet of making sure you're getting your regular vitamins from fruits, making sure you're not eating too much of a very heavy carbohydrate meals, making sure your ratio of making unsaturated fats are less. That well-balanced diet is what will keep us going. I don't think anyone needs to say, okay, I need to take this much amount of these many milligrams of zinc every day not to get COVID.
Thank you. And what kind of drugs can people stock up for an emergency? I believe this is at home.
Okay, so at home, the only drug that I would advise to make sure you keep is good old paracetamol. Panadol, whichever brand it is, paracetamol for taking care of any aches and muscle pains, we call it malaise, any fever, that is good enough. Many of the medications which people are looking at, hydroxychloroquine, I've seen ivermectin, I've seen people using antibiotics, should not be taken without advice from a medical practitioner. Drugs like hydroxychloroquine, ivermectin have been shown to have no benefit. Antibiotics, steroid medications which have been shown to have some benefit in COVID is more for those cases which have more severe illness, so should not be taken unless they have discussed with their medical practitioner.
Yeah, thank you. A few questions around the vaccine. So first of all is the AstraZeneca vaccine causes blood clots. Is that claim substantial? And another question is, if I am allergic to eggs, can I get the AstraZeneca vaccine? And another one is, can one get vaccinated after having tested positive for COVID?
Okay, so very good questions indeed. And so the first one of whether the AstraZeneca vaccine is causing blood clots or not. The steps that were taken by most of the EU countries when they did find a couple of patients, and when I say a couple, it's a couple. It was just in some countries it was just one or two cases where they found severe blood clots. They were just being cautious to look at pharmacovigilance to look at whether it was a particular batch that was tainted and was causing these problems. They were not done so that they are attributing it to just solely to the vaccine. If you look at the numbers, we have a higher risk of getting blood clots. For example, from just illnesses that from the patients who have cancers and other illnesses than from the vaccine. There was not enough data to attribute these directly to the vaccine. Some of these patients had other concomitant conditions as well. And because there isn't enough data to directly relate it to the vaccine, there is no even current screening required to say that you need screening before you can take the vaccine. The vaccine so far is safe enough for taking. Of course, for those cases who have had severe allergic reactions to vaccines before, need to at least clear it with their doctor, have a look at all what they have been allergic to before, and get advice from their practitioner before they can take the vaccine. Egg allergies are still, this is not egg-based. The protein is a vector. It's a modified virus. So egg allergies, it's still advisable. You can still take it, but again, we need to know what sort of allergy you have. Have you had very severe allergic reactions to this kind of exposure before? So for all those cases who do have those sort of allergies, it would be best to discuss with your practitioner. We look at the severity before they are advised on the vaccine. The third aspect for the vaccine of taking the vaccine in case you had COVID is yes, you can still take and you should take the vaccine even though you are exposed to COVID-19 infection. The only thing is that you need to have the infection settled first. And you need to get out of the acute phase of the infection. When do you get out of that? At least a minimum of 14 days after you have tested positive, and making sure that you are not still symptomatic at that 14th day. If you are still symptomatic, then take at least a week after your symptoms have resolved.
Okay, thank you. How should one take care of someone with breathing difficulties at home?
So with breathing difficulties, of course, that is now pointing more towards someone getting to more severe disease. Ideally, this patient should not be on home isolation. They should be in a healthcare setup. I do understand also the challenge that sometimes we may have, that the healthcare facilities are very full. They are not. They don't have enough. There may not be enough capacity, but ideally we should have all patients be evaluated by a practitioner, healthcare worker, to ensure that they are safe enough for home isolation or to continue home isolation. For those who may be having difficulty in breathing and have access to checking oxygen levels through pulse oximetry, and you have access, that should be done, at least monitoring at home. One advice I'd like to give is that because these portable pulse oximeters also are not at the same level as the higher end oximeters we use in healthcare facilities, they should make sure there is a good enough signal coming to the pulse oximeter. We should make sure that we are checking at least at a minimum 3 times or up to even 4-5 times a day. We should make sure that we are leaving on the pulse oximeter persistently for at least 3 to 5 minutes to get a good constant reading. And if those readings for the pulse oximetry are coming constantly below 94, that's a patient who should be on oxygen. So then at that point, you need to make sure that you have you are seeking medical assistance from a healthcare facility.
Okay, thank you. How safe and effective are the face masks? They hear that the size of the virus is smaller than the pores in the face mask, and that when you put on a mask, breathing the same air may be dangerous.
Okay, face masks have been one of the biggest reasons why we have been able to control infections. And by face masks, I mean face masks, not chin masks, not masks which are on the neck. We need to cover our entire face, including our nose. And with face masks, what you are doing is, if you may have the disease and you are not symptomatic, you may be asymptomatic, but you are still capable of passing on the disease. So what you are doing is you are avoiding passing on that disease to your loved ones and others by having a face mask on. People outside you interact with by having that face mask on. Yes, the virus size is smaller than normal masks, but you will need a very large inoculum or a lot of viral particles for it to completely bypass that barrier of that face mask before you start inhaling it. So face masks are highly, highly important. The only thing is that if you are using disposable face masks, they should be replaced routinely. They should be ideally be replaced daily. If you are using fabric face masks, then you should at least wash them and make sure hygiene is maintained in that. Of course, there is that risk about the face mask having a lot of inoculum or a lot of contamination. Hence, it's also very important when you're removing or wearing your face mask, you always need to practice hand hygiene and always avoid touching your mask and trying to adjust it as much as possible. Let's adjust it while we put it on, make sure the fit is good enough. It shouldn't be tight enough that it's giving you complete difficulty in breathing, but at least it should be tight enough for you can at least take a deep breath in and you're comfortable. And we make sure it's fastened properly on our nasal bridge, because what tends to happen then, if the mask keeps falling out or coming down, we keep touching it. And let's remember, any surface we touch, we are then putting it, inoculating all that onto our mask and increasing our risk.
Okay, thank you. What equipment should one buy to prepare for home-based care for COVID-19?
So for home-based care, at least having a thermometer so that we keep an eye on the on temperatures of whoever is undergoing home-based care. I would advise for a pulse oximeter, so that at least for those who are feeling any difficulty in breathing, then they should regularly also check their oxygen saturations. For those patients who may have issues with either blood pressure or diabetes, ideally should not be isolating at home. But if for whatever circumstances are making them isolate at home, then they should make sure at least they have a blood pressure machine to keep an eye on their blood pressures. For those who are diabetic, it would also be advisable to keep a check on their blood sugar levels. In terms of saying that we'll keep oxygen cylinders at home in case they come handy and all that, I wouldn't advise for that, because that's where now you need medical assistance. You need someone who knows how to handle this equipment. You need someone who knows how to adjust all these. Let's remember, oxygen is also a drug. It comes in a dose. It's not just that we start on oxygen and that's it. It needs to be adjusted constantly. So it's something whereby it's not something I'd advise people to just start keeping oxygen cylinders at home. No.
Thanks a lot for that advice. Is there a rise in the number of false positives or false negatives?
Yes, so false positives, not as much, because The thing is that because of most of our population being asymptomatic, they may be able to still give out they may be able to still give pass on the virus to others, and yet they don't have symptoms. They may be positive. It doesn't mean that if you are asymptomatic, you don't have any symptoms, that you can't be positive or you can't have COVID-19 infection. You do have the infection, even if you're asymptomatic. For false negatives, that can happen. Of course, a lot of factors determine that. The kind of test that is being done, as I said, there are some antigen tests as well, which are available, fast, rapid tests. So those are not as accurate as the PCRs. How the sample is taken, how it is transported, how it is stored, all those factors can affect false negative results. If someone is symptomatic, gets a negative result, and the symptoms are not improving or subsiding, those patients should be advised to retest. And of course, this again should be in consultation with the healthcare practitioner.
Thank you. Still on testing, are the 15-minute rapid antigen test accurate, or should one just stick to the 24 to 48-hour test? So
the 15-minute test, the accuracy is improving as more and more research is done, more and more technology comes in. However, the variability is a lot. So what I mean by the variability is some tests you'll find maybe are detecting 1 in 4, some maybe 1 in 5. So it really depends. The variation is too much in that. And the other thing is, as you are following the instructions on how to self-test of those 15 minutes or someone else who is testing on you, again, the kind of sample they have taken will determine whether that will come out true or not. The good thing with the PCR test is that the sample normally is a standard way of how to take it. Number 2 is that there is a standard protocol for safe storage, transport, and much more accurate than the rapid tests.
Thank you. So a question on the vaccine, is it free in private hospitals? And if not, what is the cost of vaccination?
Okay, so far, all the private facilities that have taken part in the vaccination exercise and are partnering up with the public facilities, it is free. However, it is only open currently to, of course, the cadres that were identified by the Vaccine Task Force and the Ministry of Health as being part of the first phase.
Okay, thank you. So the next question here. So what is the projected number of waves before the pandemic is brought under control?
So what determines how many waves or how many spikes in these infections we get is the behavior, is the culture of the communities we are in. So if we are not being careful, if we are not adhering to guidelines, if we are not doing what we can in terms of the basics of masks, hand hygiene, social distancing, avoiding big gatherings which are not permitted, where the number may not be permitted or is going beyond what is expected or what has been permitted. If we are not stopping to do all that, there will be infinite number of waves, because as we keep doing that, we keep passing it on, Let's remember, once you have COVID, it doesn't also mean you're immune for life. You can get COVID reinfection as well. Of course, what will help a lot is vaccinations. Once vaccinations are widespread, what they will help us with is herd immunity. And herd immunity will make sure that the transmission cycle gets broken. However, it will not mean that, okay, we've hit now 50 million vaccinations in Kenya, the very next day the masks are off. No. The vaccine will make sure that we don't get severe disease. But COVID-19 and coronavirus will now become like the influenza virus. It will always be there. It will always be transmitted. It's just how to control and make sure people are not getting severe disease out of it. So we are the ones who determine how many more waves we can face.
Yeah, so concern here about some people testing positive even after receiving the vaccine.
So it can easily happen. You may receive the vaccine. Let's remember that both the immune response that you build from getting COVID itself or from the vaccine is not sustained. It's not as sustained as other vaccines. Hence, most of the vaccines have 2 doses. So you may receive the first dose, you do have a bit of immunity building up, but it's not sufficient enough. So you could still catch the disease. So even after receiving the first vaccine, we cannot let our guard down at any point. So even after you receive the first dose, it's still possible, but it still helps you make sure you don't get into severe disease. By the time you get your second dose, your body is at least built up, after that it's building up at least sufficient immunity for you not to get severe disease. So if I just give a short example, majority of the vaccine studies that have been done on the safety and the efficacy, most of those studies, the population which got the vaccine, there were hardly any out of thousands and thousands, there were hardly any cases after the vaccine getting severe disease. So you may still get COVID, but it's not as severe, it's not landing you in hospital.
Okay, an interesting question here. So could private hospitals like MP Shah invest more on ICU beds? I think there's a concern that the number of beds is actually too low compared to the number of people who may actually need the services.
Yes, indeed. And definitely all the hospitals, including MP Shah, are looking at how we can invest, try and scale up capacity and capability in that. But one thing we also need to remember is that the investments and the scaling up is not just equipment alone. For example, the other day we saw an article where there was a donation of ICU beds that was done. But let's remember, it's not just that bed alone. There's a lot of life support equipment an ICU requires. All that again can still be done. Well, the major driving force of making sure that we give good and life-saving critical care to patients is the human resource, it's skilled staff. So that's something as well that we are looking at, upscaling training, upscaling on many other fronts, so that we can try and increase capacity. But let's also understand that something like skilled staff and labor may not be something that comes out in even a matter of a few months. I mean, sometimes it takes sometimes up to 15 years to train specialists, doctors who are specialists. So it's something that many places are making sure, trying to upscale on the expertise available. But one major challenge will still remain human resource.
Okay, thank you. Can someone be tested to ascertain their immunity to the coronavirus? And if they're immune, do they still need to get vaccinated?
So the serology test that we were talking about, which checks for antibodies in your system, that can tell you that whether you have those antibodies or not. It may tell you previously you may have had infection and maybe you didn't know you were asymptomatic. However, that in itself will not tell you whether you are immune or not. The reason being, as I said, the immunity does not last as long. It gets boosted and it gets augmented by the vaccine, the immune response you build from the vaccine. So the vaccine should be taken, because there is no test which will tell you whether you are immune or not. As we said, even with the vaccine, after the first dose, you can still catch COVID-19. So similarly, even if you had COVID before and you built a bit of immunity, even if you have antibodies circulating, yes, less likely for you to get the disease or get a severe form of the disease, but it doesn't mean you won't be able to catch it at all.
And still on vaccines, should people with pre-existing conditions take the vaccines? Are there any contraindications, and are there vaccines that are considered safer for them?
So far, the vaccines, in terms of safety of looking at the various disease groups, is almost similar everywhere. Of course, in pregnancy and children, there's still more studies to be done. Pregnancy, mostly it has to be a discussion of looking at the risk versus the benefit, discussing with your obstetrician and gynecologist about what are your risk factors of getting severe COVID disease. If your risk is much more, then of course you are given of getting that severe COVID, then you should be given the vaccine. In terms of the other comorbidities, that's the population that especially needs the vaccine. Because as I showed earlier as well, just as everywhere else in the world, the trend has been the much elderly population and the population with comorbidities are the ones getting severe disease, are the ones contributing the most to the mortality as well. So that population definitely should get. The only absolute contraindication to getting a vaccine is if you're allergic to any of the contents of the vaccine, or if you, for example, got the first dose and got a severe allergic reaction to the first dose, then yes, that would be a concern for getting the second dose, and that then would require specialist input to look at how we can either consider trying another type of vaccine, or advising against the use. But for 99% or even more, almost 100%, it shouldn't be a problem.
Okay, thank you. So what is the current remedy to slow down the infection once someone gets COVID?
So in terms of slowing down the infection, nothing has really been proven to be 100% in terms of saying that, yes, this will definitely make sure you don't get too severe. There are some drugs that have been tested and still in investigation phases, like steroids that we spoke about, but again, it's for patients with severe disease. There are some medicines which normally slow down the body's immune response towards the vaccine, because when you get very severe disease, actually the immune response is also so heightened that it's also causing more harm to your body than any good. So there are some medicines that do slow down that response. And then, of course, there are some antiviral medicines that also have been studied. However, none of these are meant for self-treatment or treatment while you're in isolation. These need to be looked at on individual cases by the doctors who are treating these patients and who have severe disease. So again, it's a risk versus benefit. Let's remember these medicines also come with their own side effects. So will the benefit from the drug be much more than the side effects is what will need to be gauged.
Thank you. There's a compliment here from one of the attendees. Thanks for your explanation on flattening the curve. And then another question, is the current strain different or more contagious than the one we've had previously?
Yes, so as I was explaining, we do have the study that KEMRI carried out. They had found some strains of the South African variant, of the UK variant, the mutated variants that have been found there. They did find some of those in our population as well. So we do have different strains circulating at the moment, and some of them are more virulent. They are easily transmittable. There isn't a lot of data to say they are also more severe and more deadly. That has not yet 100% been proven. But yes, we have different strains. We have strains which are spreading much faster.
Okay, so the next question here, how long after treatment is someone still infectious?
So generally, again, the data on this is a bit controversial. The data, some studies have said that you can, as long as you are positive, you are infectious. Some studies, of course, are saying that if you are not symptomatic, you are unlikely to pass it on. But generally, after the 14-day period, you are not infectious. Hence, we put the mandatory quarantine period still remains at 14. CDC guidelines are even cutting that down now to 10 days, that if you've been symptom-free for 3 days and you've completed 10 days since your first test, then you should be fine to continue. But then again, one thing I'd like to remind all our attendees today is when you come out of quarantine, it's still with all the protocol, with all the precautions in place. It's not that once you're out of quarantine, that means I'm okay without a mask, I'm okay in crowded places, I'm okay not to be practicing hand hygiene.
Thank you. In your opinion, do you think that an emergency lockdown will help to manage the current wave? People are about to celebrate Easter, and there's going to be a lot of travel.
I think yes, it could help, but at the same time, what we need to look at is we are also hurting as an economy, and that's why it may be difficult for the authorities to bring that. But yes, a lockdown would certainly help the current situation we are facing, especially in Nairobi County. However, we as the people have a much bigger social responsibility. We cannot say that it will only be a lockdown that will keep me at home. It will only be a lockdown that will keep me from mingling with others out of choice, where it's not mandatory. For example, with gatherings which are in poorly ventilated places, with gatherings where we are not really taking care of social distancing, masks and hand hygiene. So without that social responsibility in us, I don't think lockdowns help, because even with lockdowns, if you're still doing the wrong thing, if you're still not taking care of each other, then it's not going to help. So we have the much bigger responsibility in making sure that that helps.
So which major side effects have been reported by the people who have received the vaccination? Maybe you can give us the experience from your hospital staff.
The experience from our hospital is mainly the very common side effects. People are getting some flu-like symptoms, some may get some fever, some have reported nausea, some are getting headaches, but it's short-lived and you tend to bounce back from it quite fast. Some are reporting muscle aches, feeling tired and fatigued. But as I said, it's very short-lived, and of course, pain at the site of where the injection was given. But we haven't really had any very major side effects so far.
Okay, so an important question here: if someone tested negative yesterday, and the next day they start showing symptoms, should they be tested again before they interact maybe with employees? What is the recommended test?
Yes, so again, it really depends on what sort of symptoms you are showing. If it is symptoms which are indicating towards fever, then you need to be evaluated first. You may have some other sort of infection. Let's remember also, not every fever is COVID. When you do get seen by a health practitioner, medical practitioner, they will look at trying to identify what other causes of infection you may have. We still have malaria, we still have the flu, we still have diarrheal diseases that can give you fever, we still so many other diseases which can present with that. So again, it would be, do not go retest yourself, get some medical advice first.
Okay, thank you. A question around what's the rate of reinfection in Kenya, and how is it affecting patients?
So there isn't really a lot of data to tell us how much reinfection we are having. But sorry, I lost you on the second part of the question. I lost the connection a bit. What was the second part?
Yeah, so a question around reinfection and how does it affect those who get reinfected?
Okay, so reinfection, the data in Kenya is not as much for us to really say that how much of it or how many are we seeing so much. It's still isolated cases. But the thing with reinfection is you may still get mild disease, you may still get severe disease. It will still depend a lot on your other concomitant conditions, such as if you're at risk by being elderly, if you're at risk by having, let's say, cancer or high blood pressure, diabetes, all the comorbidities that normally do chronic lung disease, chronic kidney disease, which do give you more severe disease if you catch it. So again, it's different from individual to individual.
Okay, thank you. How safe is sharing of microphones from a transmission perspective?
So for microphones, headsets, mobiles, what I'd advise is that when we are sharing it, we make sure we are wiping them down. We make sure that we are sanitizing our hands as well before we can start using them. So ideally, as much as possible, try not sharing, but when you have to, if it's something that's not in your control of not sharing, then you just need to wipe down with simple chlorine-based solutions. Of course, you need to look at the product itself as well. There are some materials that can get corroded by alcohol, for example. So if you are trying to use a sanitizer on that kind of surface, you may ruin the product. So again, looking at what sort of product it is, some may need a wipe, some may need a chlorine-based solution, some may need an alcohol-based solution, but something would be helpful to sanitize it.
Okay, thank you. So are there cases where one remains positive, that's the COVID test, for say like 2 months, and how long will the virus stay within the body?
Yes, we have seen cases where someone can stay positive for very long. The reason why we used to see this is because world over, including Kenya, the requirement before, when you went into quarantine because of positive tests, you would be required to make sure that you have 2 negative tests before you can come out of quarantine. And that's why we could keep doing tests to make sure until we get to the 2 negatives. But now the requirement is that if your symptoms have settled, then you are safe enough to be resuming normal work, and hence the retesting may not be as much. However, yes, you can stay positive, but the data is not comprehensive on that you are still transmitting the virus if you stay positive. As long as you become asymptomatic, you are less likely to transmit it.
So for someone who's vaccinated, can they still transmit the virus, and should they wear a mask?
Yes, so someone who is still vaccinated will still be able to transmit the virus. They should still stick to all protocols until, as a country, as the whole world reaches that level where everyone has built up sufficient immunity for the virus not being passed on from one person to another. So until a time like that comes, we will still need to be cautious. Yes, we will reduce the disease burden quite a bit. You will not be seeing these waves after the vaccination process has covered most of us, but you still need to take precautions even after you've taken the vaccine.
Thank you. So for people who are taking medications, do they need to stop them before getting a COVID vaccine? For example, someone who's taking blood thinners, what's the recommendation?
So any medication that is being taken, I don't think it needs to be stopped. However, there are some certain categories. For example, if someone is in a heavy dose or rather a very strong dose of blood thinners and has not been monitoring, or they are at risk maybe of even bleeding at the injection site, which is rare, but it can happen, or other disorders. For those who are on regular blood thinner medications, just again pass it by your medical practitioner. It's not a contraindication for you to get the vaccine, but depending on how what that blood thinner is being used for, and depending on how your control of that blood thinning is in the body, depending on that, there may be some adjustments that are made or advised by your healthcare providers. So again, it's just making sure you discuss it with them before you time your vaccine.
Okay, thank you. Does the vaccine protect you from all the variants of corona? And if there are more mutations that will come, what is the guarantee that the vaccine will protect against all the variants or mutations?
So far, yes, it is protecting against most of the variants and mutations, because the one good thing is that the mutations have not been severe enough to change the kind of the kind of targets that we have for the vaccine. The proteins or the receptor that are targeted, that are present in the coronavirus, that are targeted to for the vaccine to build up an immune response against, those are not necessarily changing drastically in these mutations. If the virus mutates in that form where it's actually changing that, then yes, maybe more booster vaccinations may come up to cover against those as well. But so far that hasn't been seen, and the vaccines are covering most. And as I said, the most important bit is once all the vaccines that are available are making sure you're not getting severe disease.
In light of the trends of asymptomatic and symptomatic COVID, should we conclude that temperature checks is an invalid way of detecting COVID-19?
Yeah, so temperature checks may not completely, of course, they're not diagnostic of COVID, but at least it will tell us if we need to filter anyone. Yes, sometimes we also question the way they are carried out, but one thing I think as a screening tool, it may still be applied so that it can also be a deterrent for someone who may be having a fever and thinking, okay, it can't be COVID, let me just go visit the shop, let me just go visit the restaurant. No, it may be a good deterrent as well for those for that. But the other thing is that temperature checks again does not mean that if my temperature is okay while I'm entering the supermarket, I can drop my mask, I can wear it at my chin, that I can stand very close to other people without any issue because everyone's temperature has been checked and we are okay. I don't think that we should get rid of it. As I said, it helps us filter and deter. But apart from that, even if, for example, let's say in the ideal world, there was a way of checking maybe with a breath test before you enter somewhere whether you have COVID or not. Even with that, maybe you get a false negative on that and you enter the area. How sure are you that there is no 100% way anyway of excluding someone who may have asymptomatic infection and can still pass it on? So I know people may not like this, but unfortunately the masks, the hand hygiene, the social distancing is here to stay for
now. Okay, and there's a number of drugs that have been mentioned to be effective once one tests positive. Things like ivermectin, HCQS, zinc, azithromycin. There's one called Ubinext. Just a quick advice.
Okay, I think yes, perhaps maybe some viewers may not have heard me properly. What I had said is they are not effective. They haven't been found to be effective. So zinc and the other multivitamins and the rest do help your immune system, even generally without COVID, but they are not a treatment for COVID. Azithromycin is an antibiotic that can be used if you have superimposed bacterial infection or bacterial pneumonias on top of together with COVID, but that can only be taken after consulting your healthcare provider and they have checked and have had suspicion of that happening. Ivermectin, hydroxychloroquine, so far in the literature that we have, in the literature that we follow, has not been seen to be effective. So I'll repeat, they have not been found to be effective.
Okay, thank you. The other question is, and you've spoken into it a bit, but the people with various conditions, so things like asthma, I think people, lupus, hypertension, diabetes. What's the advice with regards to vaccination?
I think those conditions are especially the target groups in the second phase where we are targeting the vulnerable population. So those are the ones with the comorbid conditions are the ones who should be getting the vaccine and make sure they do not develop severe disease. So just by having a comorbid condition does not exclude you from taking the vaccine. The two groups that I explained, so far as the Oxford AstraZeneca one, which is approved in Kenya, is not recommended for anyone aged under the age of 18. So it's not recommended for anyone below 18. And also with pregnancy, it's a risk versus benefit situation where you have to discuss and make an informed decision with your primary doctor.
And what measures are being taken in hospitals, especially inpatient, to avoid the spread of COVID?
So we are looking at, of course, some are practicing doing tests on all patients. Others are looking at going based on symptomatology or going based on the risk stratification of such patients. Contact precautions in terms of making sure that when a healthcare provider has had contact with you or seen you, that they are practicing all that is necessary in terms of hand hygiene, sanitization, disinfection of surfaces before they attend to someone else or before they take any other patient into that area. Of course, looking at making sure that we also are, most hospitals are actively looking at reducing traffic. And that's something where we need the viewers here who are here to understand. Having a patient in hospital, your loved one in hospital, is a very difficult thing, is something that's not easy for the patient or the family to go through. But the reason for us, for most of the hospitals now being very strict on visitation policies is because we don't want our patients or your loved one that we may treat to be getting COVID from outside, from the visitors who come in, for example. So hence all the measures we take for early screening, infection prevention and control through all the practices of hand hygiene, sanitization, disinfection, and also reducing of crowds in hospitals.
Okay, thank you. Are breathing support devices recommended for people who have COVID? I think these are spirometers and the like.
So yes, for anyone who has COVID and breathing difficulties, the spirometers and those that things that help improve your lung function and capacity, lung rehabilitation, are advisable. But again, it depends on your capacity. So if I'm right now not getting in enough oxygen, and I'm trying to do an exercise like holding my breath for long so that I can expand my lungs and those sort of things, it can be detrimental. So yes, they can help, but you need to be then clear to make sure you are safe enough to be doing those exercises. So for example, if you have your oxygen levels are too low, you wouldn't be able to do those exercises without getting oxygen supplementation. So assist devices, many other things, unfortunately not in the home setup. The home setup, those patients who may be on what we call on BiPAP or other machines which are useful for obstructive sleep apnea, those can still be continued for those who've been using them previously, but again, in consultation with your doctor.
Okay, thank you. So there's a question about young people who are being infected and dying in other parts of the world, South America and the like. So could we see something similar in Kenya?
Yes, we have. We have seen that happen here. We have seen isolated cases. Fortunately, it hasn't been a pattern or enough to make sure to tell us that, okay, now that the progression is completely shifted. But it doesn't mean that if I'm young, I cannot get severe disease, I cannot get COVID. So the best strategy we have is trying to avoid it in the first place. So it is unpredictable. There is no single test to say that, okay, fine, if I have ABCD, if my tests are showing ABCD, then I may not get very severe disease. So it's about following instructions. It's about seeking medical assistance at the right time, but start with doing your best to prevent getting the virus.
Okay, so we have a question here about, so there was around, what are the recommended masks for people to wear? And I think there's someone here asking, what kind of mask are you wearing?
Okay, so recommendations on masks, you may wear anything from fabric mask, which has a dual layer, to surgical mask. Surgical masks are mostly disposable, so unfortunately you won't be able to wash them and rewear them. So if you are able to get enough supply to make sure that you are disposing them off correctly and at the right time, then you can do with surgical masks. The fabric masks, making sure that we are regularly washing them to make sure you're not getting them contaminated. And of course, if you're washing, you need to have a spare. The one I have right now, it's called a KN95 mask. It does offer, it does block out a bit more compared to a surgical mask, but it doesn't mean that everyone requires this kind of mask. I wear this because I have to frequently visit areas of the hospital which may potentially have some isolation cases as well. Of course, if I'm going into a room with an isolation patient, then it's a totally different procedure. I have to be in full PPE, including the right mask, which is not the one I'm currently wearing.
Okay, just kindly speak into some of the new symptoms that are being associated with COVID, e.g., diarrhea.
So there have been some reported cases of patients coming with gastrointestinal problems, mostly abdominal pain and diarrhea, together with fever, coming with those symptoms as part of COVID. And it's not a large enough population to say that yes, this has become one of the main symptoms. It's still not as widespread as the common ones of cough, difficulty in breathing, fever, so fatigue. So we have seen those, and that's why, again, if it's something where you started having these symptoms and they are not settling and it's associated with a fever, then it would be prudent to at least be evaluated.
Okay. For someone who has COVID, is it recommended for them to do cardio exercises like walking, riding a bike, or are those considered to be high risk?
So again, it depends on your symptomatology. So if you are a symptomatic patient with difficulty in breathing, of course requiring oxygen, then naturally strenuous exercises are out of question. If you're someone who is maybe mildly symptomatic, I would say you still stay away from very strenuous exercises. You keep an eye on your oxygen levels. After you recover, you can get back to those. For those who have asymptomatic disease, they should still be isolating, but they can still carry on with their workouts or training at home as long as they are not having difficulty in breathing. Remember, inside, when you're self-isolating, if the place where you're self-isolating can afford you the space, for example, to maybe take a stroll or walk, then that should still be done. As long as you are doing it safely, you are not interacting with other people.
Okay. So, will you comment briefly on the cost of managing someone who has a moderate disease in a ward setting, or someone who has severe disease in a HDU or ICU setting?
Okay, it is a bit difficult to predict because, of course, we say moderate and severe in ICU, but the major problem that we normally get is that you may have just moderate disease, but then your requirements in terms of the medications, in terms of oxygen therapy, in terms of rehabilitation, and many other things may be different from someone who who doesn't need all that. So, for example, you may have moderate disease, a mild pneumonia, a moderate to severe pneumonia. You come in, you require oxygen. Maybe you get oxygen for a couple of days, and then you're fit enough to go home. Versus someone who may not get to the critical state but still requires oxygen for a prolonged time, rehabilitation for a prolonged time. Naturally, those two will be very different. So it is extremely difficult to predict. But however, of course, after we've had the case with us for some time, we can at least then try to now start gauging. So we are individualizing it at the moment in how we advise families or patients on the costs.
I can see we still have quite a number of questions and we are running out of time. So we will just take the last question. So tell us about double masking.
Okay. Double masking has been brought out among many forums. I think quite a few people also said that some even thought the double mask helps more because of the new variants. But the science and the thought behind the double masking is actually not to add an added layer of protection. It was more to get a better fit. So, for example, if I have a mask, surgical mask, which is not fitting properly, and I put on another one on top of it, the virtue of that mask now putting pressure, it will give me a better all-round fit. That was the rationale behind some places even advocating for double masking. But there are other things we can also do to make sure that we have better fit. So if, for example, someone may have a smaller facial structure and they've not got the right size mask, it's too big, it has gaps that is allowing air in and allowing expulsion of air as well. There are some devices like these bands you can put to tie the straps to or to hook on the straps to so that you get a better fit. So it's all about making sure that the fit is better, it's comfortable for you, and let's remember, it's not something that should make you suffocate or feel like you can't draw in air. So you have to make sure that the fit is according to how you can tolerate it. But at the same time, most of the masks allow you to breathe freely. So again, if someone is saying that the moment I wear a mask, I can't breathe, even the normal small fabric or the surgical masks, I think, as I said, just a bit more social responsibility from those individuals and explaining to them that this, yes, it's a bit of an inconvenience, but it is what is protecting you and me.
Okay, thank you. I think we'll close the Q&A session at this point in time. Thanks a lot, Dr. Vishal. I think maybe as give your closing remarks, you can tell us what you think people need to do now that we are heading into the Easter holiday.
So I'll say try to restrict your travel if it's non-essential. Because right now, with the number of cases going up, we are in this wave and we have a very high positivity rate at the moment. Past 1 week, we have been the highest in Africa, unfortunately. So we really need to make sure that if it's not essential travel, let's not do it. Wherever we are at our places, the basics, hand hygiene, coughing etiquette and sneezing etiquette, masks properly worn and correctly worn masks, and social distancing. Yes, it may not be possible everywhere, but when you do it for majority of the instances where you can, you're winning half the battle. The other thing that I'd like to urge everyone, as I said, we don't need to have the government tell us don't congregate in areas. We don't need to have the government tell us you'll be fined if you don't wear a mask properly. We need to do that ourselves. We shouldn't have sanctions imposed just because people are not wearing masks properly. That much responsibility every citizen owes to themselves and to everyone around us as a community. Last thing is that when you have a COVID infection, do not try to self-treat. Do not believe in all the myths. Believe in science. And with science, talk to a healthcare provider. Talk to your regular doctor, or even if you don't have one, the nearest health facility near you, because self-treatment can do you more harm than any good.
Okay, thanks a lot. Our attendees, that was Dr. Vishal Patel, the Medical Director at MP Shah Hospital, who's been taking us through this webinar for today. I think the most important message today is personal responsibility. We all know what needs to be done, so let's take that responsibility. From UFP, we want to thank you for making time to attend this session. We thank you a lot, the MPSHA team, for agreeing to have this session with us to continue enlightening our members on what is happening in the COVID-19 pandemic. Just to mention that all our medical covers do provide for coverage for COVID-19. You can always get the specific details from your relationship manager or your agent or your broker. My name is Dr. Elijah Matolo from the UAP Insurance, and I've been your moderator. And I want to wish you a happy Easter and stay safe, everyone. Thank you.
Thank you, everyone.